Thank you very much for coming, and I'd also like to thank Dr. Coyle for allowing us to have this forum to be able to present information to all of you. Today we're going to talk about the shared medical visits for diabetes. The shared medical visit is the power of the group dynamics combined with the touch of personalized medicine. We know lots of different kinds of groups. There's family, religious groups, friends, we're part of work, we're part of team. But we have a new group, the multidisciplinary team at Emerald Physicians. At Emerald Physicians, we have the 4 C's, and I don't mean the corner ice cream store in Centerville or the college over off 6A. I mean our 4 C's of comprehensive, coordinated, caring, and cutting-edge approach to your medical care using this shared medical appointment. So let's just take a look at the facts to see if that's what groups come up with for evidence. The Multi-Center Lifestyle Project showed that attendance to group support visits correlated significantly with improved blood pressure in the Multi-Lifestyle Project study. Those who had the highest rate of attendance had the most improved blood pressure. In a study of Native Hawaiians, lifestyle improvements such as weight loss, exercise, and risk reduction for cardiovascular disease, the study showed that it could be achieved by education, positive role modeling, and most important, the group support. Also in 2010, a Canadian study showed that lipid management, cholesterol management, improved with lifestyle modification, stress reduction, combined with the group support visit. Also, in reviewing 6 studies for diabetic care, formal group visits were associated with improved outcomes. But this was very interesting. Informal support of family and friends actually caused negative outcomes, meaning the positive outcomes came with the formal support of the group visit. A study in 2010 showed improved behavior at 4, 8, and 12 months in a study about physical activity and healthy eating with group visits. In a cardiovascular disease lifestyle intervention project, it showed that low social support, in other words, people who did not have a lot of support, showed poor adherence to any kind of diet or exercise program. So the power of the group, the dynamics of the group helping a person to have positive lifestyle outcomes are very important. And in a 2-year trial of a vegan diet versus a moderately low-fat diet, the vegan diet showed more weight loss than the moderate low-fat diet at both 1 and 2 years, but most important, that the group support and attendance to the group support visits were associated the most with weight loss. So why should we have group medical appointments? Well, first of all, they're longer visits. The visits are 90 to 120 minutes, and they're at a much more relaxed pace, so there's plenty of time for a discussion within the group. With that great amount of time, there can be improved provider-patient relationship, interaction between you and the physician, nurse practitioner, or physician's assistant. Also, because of the multidisciplinary team involved in a group visit, meaning there are lots of different people involved, the provider, the physician, nurse practitioner, or physician's assistant, the registered dietitian, diabetic certified educator, the life coach, the registered nurse. Through all this team, you can have more accomplished through that one visit. Also, the group visit is very helpful because in a group setting, someone can be asking a question that you may never have thought of asking, but yet you can find that it's very pertinent to your particular lifestyle. You also get help and support from others within the group. There's helpful information provided, new ideas on how to approach, how to knock down those barriers, preventing you from having positive lifestyle changes. Also used in the group visit would be mind and body techniques along with traditional diet and exercise. In shared medical appointments, studies show a very high patient satisfaction. People get a lot out of this type of visit and really enjoy them. It's also important because there's close follow-up care here. It's not one visit, it's a series of visits, and your progress is closely followed. So, the power of the group dynamics with the touch of personalized medicine. The shared medical appointment is high quality. It's accessible. It's at times that are accessible to people in the community. It's an efficient visit. A lot gets done in that amount of time. And it's a healing experience that's shared with others in this confidential setting. So what are these shared medical appointments? It's anywhere from 6 to 12 patients, average being 6 to 8 people, with a signed agreement of confidentiality. It's very much like a regular visit for one part in that your medications are verified, refills are given if needed, blood pressure, weight, pulse are checked. You're assessed for any issues that you may have going on regarding the problem that's presented that day. In this case, it would be the diabetes. And treatment, education, and goal setting are all part of this visit. So once again, we have the team of the provider, the registered dietitian, certified diabetic educator, life coach, and of course, our registered nurse.